I've been feeling so,
Assalamualaikum and a good day to everyone. In this video, me and my friends are going to explain about air gap technique. My name is Nurul Udina Ilham Tias Mizal and my members' names are Nur Suhailah binti Muhammad Isa and Nur Fatihah binti Rosli.
For the definition of scatter radiations, scatter radiation is an unwanted radiation or a type of secondary radiation that will interfere in imaging process, and it does not add any valuable information to the image. During the passage of radiation through a substance, the radiation has been changed in directions. It may be also modified by a decrease in energy. When an X-ray beam enters a patient's body, a large portion of the X-ray photons involved in Compton interaction, which is occur in the incidence of X-ray photons, is deflected from its original path by an interaction with an electrons, and it produces scatter radiations. Compton scattering is dominant at higher energy, while at lower energy, the absorption of the photoelectric interaction is more absorbed.
Okay, hi, Assalamualaikum. My name is Nur Fatihah binti Rosli. So, before we continue with our presentation, before we continue with the topic that we choose, so I will give some brief explanation about scattered radiation. Okay, scattered radiation is an unwanted radiation, or also known as one type of secondary radiation that will interfere in imaging process. So in this case, scattered radiation will interfere our X-ray examination. And scattered radiation does not add any valuable information towards our image. Besides, scattered radiation give some problems such as image noise, reduce contrast in our image, and also make our image less visible. And these problems give problem to doctor and the radiographer in critiques the image. Okay, then I will continue with our next slide. Okay, in this slide we will talk about method used for reducing scattered radiation. Okay, as you can see in this slide, we use three methods. Okay, these three methods always used by our radiographer. Okay, first is grid. Okay, grid have have many size, so we have to choose. We have to pick the best size that exact with our cassette. Okay, then second is beam restriction. Okay, in beam restriction we use beam collimator, cones, or and cylinder. Okay, then third method is air gap technique. Okay, so I will continue with our next slide. What is air gap technique? Air gap technique is one of radiographic technique that improve our image contrast resolution by reducing the scattered radiation that reach the image receptor, which is our cassette. Okay, then in addition, the MAS will increase 10 centimeter per 10% per centimeter of air gap. So for your information, if we use air gap technique in our imaging process, the result will be same exactly like using an 8:1 grid. So in this case, we don't have to use the grid anymore. Okay, how the air gap technique is applied in our imaging process is, first of all, we have to place the film 10 to 15 centimeter away from our patient, so there will be some air gap, then the scattered radiation will diverge away from our image receptor. Okay, that's how the air gap technique works in our imaging process. Okay, thank you.
The advantages of using air gap technique is this technique is more effective in removing scattered radiation that directed more to the side when performing projection that require KVP below 90. Next, this technique will increase the contrast when the distance of object and image receptor is increased. This will reduce the amount of scattered radiation. Lastly, air gap technique can help decreasing the exposure. The exposure will be lower than when using grid. However, there are some disadvantages of using air gap technique. Firstly, this technique is not effective in high cavity because scattered radiation X-rays aim in a more forward direction. Other than that, this technique can lead to a blurred radiograph. It will result to lost sharpness due to the increase of object and image receptor distance. Last but not least, this technique will cause image magnification because the distance between object and image receptor is decreased.
Through the picture provided in slide, as we can see, the separation of patient's body and receptor of film surface at about certain spacings. As shown by the picture, there are slots with a 5 cm spacing for the holding of the image receptor at different levels. By using this technique, scatter radiation that is received by the film is reduced when the air gap distance increases. This is because the scatter radiation leaving a patient's body is more divergent than primary beam.
Okay, so we have reached to the end of our presentation. Okay, in finishing this assignment and in studying this topic, we refer to our lecturer note by Puan Juliana and also Dr. Sufyan. Okay, besides that, we also make some references on the internet and on the YouTube video. As you can see here, we have provided the link. We also take some information, we take some points from the article and the journal that we found on internet, because there is the one and only our sources. Okay, then I hope our presentation today give some knowledge to everyone. Okay, I would like to thank to our lecturers, which is Dr. Sufyan and also Puan Juliana, in teaching us this topic, this subject, and also thank you.
I'm feeling so down, yeah. Can you tell me why? Can you tell me why I'm down?